So he's truly one of us. So without further ado, I'd like to welcome Dr. David McCaleb.
Thank you so much for having me here. I can't thank you enough. It's an honor. It really is an honor to be here among people who are going to stand up for liberty, stand up for the future of the country, because you're really fighting not only for yourselves, you're fighting for all of our children, and I feel like you're fighting for my children. So I can't thank you enough for fighting. I'm going to change my introduction because I mentioned that I go to the AMA. Well, I go to the AMA because I'm trying to overthrow their leadership, okay? They have a campaign. I'm running for office there at the AMA, and the Florida Medical Association is supporting me in that, which was a huge political coup. We'll go have some beers and we'll talk about that one day.
Yes.
What I want to talk about tonight is health system reform. Okay, and I've modified the presentation I was giving before this monstrosity passed, and I've updated it with some of the bad things that are in the bill and finally passed, and there will be time to ask some questions later, so if you have a burning question, if you try to keep it in mind, and we'll get to it at the end of the presentation. I want to talk about how Congress wants to ration care, and I guess now we should say the federal government, not just Congress, and resort to cookbook medicine. Let me see if this is going to work for me. Come on. There you go. All right, well, here's what's driving all of this. The fact that government has made promises that it knew it could never keep. Back in 1965, in Lyndon Baines Johnson's Great Society, we passed Medicare. Now, Medicare sounds like a great idea, and it has helped a lot of people. But it had that one problem that happens in socialism that Maggie Thatcher talked about. At some point, you always run out of other people's money. All right? And that's what happened, which is why now we have, depending on how you count, anywhere from a $38 to an $86 trillion unfunded liability. So basically, Medicare demonstrated why the first three letters of Congress are con, because they conned the American people with this. They gave them all sorts of promises. We're going to take care of you forever, don't worry about it. Problem is, they took all your money away from you. They took it from your paycheck every working day, and they said, don't worry, it'll be there, you can trust us. Of course, they then spent it on bridges to nowhere and congressional pork and anything else you can think of, and so now all you're left with is a file cabinet full of IOUs in West Virginia. And those IOUs total $36 trillion, $38 trillion. 86 comes from the total life of the whole program beyond 70 years. So there ain't no money there. And that's what's driving this, because they realized, uh-oh, we got caught. Now what are we going to do? I know, let's create an entitlement, the same kind of entitlement for all of America. That makes sense. That'll change the status quo. Well, they didn't quite go back to check reality when they came up with that plan. So now, because they have no money, they realize they have to ration care. There's no other way to deal with it. They're going to have to ration care. They're going to have to increase taxes and the like in order to make up for this shortfall. Now, there's a reason why we have a real problem in America. There is a real health care problem in America. Health insurance costs way too much. Medical care costs way too much. It's ridiculous to have to spend the amounts of money you have to spend to get what you get, and to boot, have to get in the doctor's office and wait an hour to see the nurse for 10 minutes and see the doctor for 3 minutes and leave scratching your head. I don't think people are getting the best medical care they can. And the reason we have this problem is a third-party payer system, whereby someone else pays for the benefits you receive. So it doesn't matter whether or not you need an MRI. If it's someone else is paying and it only costs you 10 or 20 or 50 bucks out of pocket, sure, I'll take 2 of those. Just had one last year, no big deal. Sure. And it goes on, and that's why we have medical inflation. That's why when all of the rest of goods and services in society have gone up about this much % since 1947, medical care has gone up here. Despite Medicare, despite HMOs, despite every attempt they have to centrally plan the medical economy, medical inflation is running rampant. They can't control it because there is no real market in healthcare. They say the insurance companies, the people on the big government side like to try to tell people that the insurance companies is a free market. Well, it's not anything like a free market. It's a government-created insurance company cartel with heavy regulation that takes your money and keeps as much as they can and spends as little on you as possible. That's what we have now. It's a cartel that prevents you from buying across state lines. It's a cartel that allows managed care with rationing through HMOs that is created by Richard Nixon's policies, etc. It's not health insurance. It's not market-based, low-cost insurance like you get from the Geico lizard selling insurance on TV. Okay? That's where you get real competition. So this is what motivated the big push. We're going to reduce costs. We're going to guarantee choice for everyone. These are the 3 big bullet points of President Obama before the big push. We're going to ensure all Americans have quality, affordable health care. That was the plan. All right, now we all want, there's no doubt everyone in this room and everyone in America wants high quality, affordable, accessible care with lots of choice and individual controls of medical decisions. No doubt about it. That's not what we just got. All right, in fact, we got the opposite, even though they like to tell you that you got this. That's not what you got. Let's talk what they mean about reduced cost. When they say reduced cost, they mean ration. They mean reduce their cost, not reduce your cost. Reduce the cost for government programs like Medicare and Medicaid. Reduce the cost for the big insurance companies. All right, no matter how much they like to claim there's a war on the insurance companies and Obama likes to get up there and go after the insurance companies, they're all in it together. Okay, the insurance companies were spending millions and millions, tens of millions of dollars pushing this for a year. When they talk about guaranteed choice, well, that was going to be the public option, which disappeared, and I'll talk about that. But it's still going to be very limited choices, and I'll describe that in a little bit. And universal coverage, they say that everyone is going to be covered. And there's this concept that we have a right to health care, and that simply by being alive in America, you have a right to get all the medical services that anyone could ever provide. The problem with the government creating those rights is that the government then has to take away from someone else and deny them their rights in order to distribute that right or that service or good or price to someone else. There is no way that the government can create a right for something without hurting someone else's rights. And I'll describe that in more detail. Universal coverage has been a failure and will be a failure. So we see 2 different philosophies here trying to describe how we can control costs and get affordable care and all that good stuff. We have 2 competing philosophies. One of collectivism, which says that we're going to put all the money in one pot. We're going to have a centrally planned medical economy where a bunch of arrogant elite panels are going to decide what should be covered, when it should be spent, who the doctors are, what they can provide, what they can't provide. That's the most important, what they cannot provide. And we're going to tell everyone that they are now duty-bound, because the state is providing this, they are now duty-bound to live by the rules of the state. You are now duty-bound not to eat the Twinkie, or smoke the cigarette, or drive over 55, or get in a car with a cell phone that you happen to be talking on. The restaurants are now duty-bound to put their calories in every menu, etc., etc. It all goes down to you are serving the state. That is what collectivism is all about. If you really want to understand collectivism and central planning and serving the state, I recommend to you Friedrich Hayek's The Road to Serfdom. In 1944, he wrote that. Excellent book, Friedrich Hayek, The Road to Serfdom. Or go on YouTube and YouTube it. Road to Serfdom, 5-minute cartoon. You'll get it like that. It's beautiful. This is diametrically opposed to the philosophy of individualism, which is a free market control. The free market will control the prices. I just drove here and I just had a sandwich, okay? Now I spent about $10 for dinner, okay? I got to choose what I bought. I got to choose that I'm going to be at the last minute. I don't have much price control. If I wanted to, I could have gone to the place down the road and gotten a cheaper price. I choose. The market sets the price based on what I'm willing to pay, based on my need. All right? There is no government saying that all sandwiches will be created equal and all sandwiches will cost the same, so that someone who is working can now get the right to a sandwich, okay? The market prevails, and I can go find a cheap dinner within 5 minutes anywhere I want in America, okay? That is the market working. I can now go into Best Buy and buy a plasma screen TV that was completely out of my reach 5 or 10 years ago for almost nothing.